Hello friends, I am Dr. Mohsen Khan. I am a consultant, minimally invasive general, gastrointestinal, endocrine and bariatric surgeon. People ask me very often, Doctor, what is the relationship between my diabetes and my weight? So the weight, when you're overweight, the cells, they have to function more. You have more glucose to burn and the cells have to produce more insulin to burn it. Since your pancreas, it has its own capacity. It would run to deal with it. But over a period of time, it would exhaust. And when it gets exhausted, still you have a hell lot of sugars in your body to burn, which causes you diabetes. So overweight or obesity has a direct relationship with the diabetes. It was recently found that among the patients who had diabetes, 45% of the people who had diabetes were obese. Amongst diabetic patients, 15% were super obese or with very heavy weight. So this shows us that it's directly proportional. The weight gain is directly proportional to your increased blood sugar levels. Also, apart from the overfunction or the not able to cope up with the extra sugars, you may develop the insulin resistance, and the cells, because of extra fat, they develop the insulin resistance, which causes diabetes type 1. When your pancreas is not able to produce extra amount of insulin to deal with these cells, you get type 2 diabetes. Hell lot of sugars, your decreased insulin levels, or the insulin resistance causes you diabetes. Diabetes causes you obesity. This is a vicious cycle wherein each of them augments each other and you land up into grave. So you have to deal with diabetes, you have to deal with obesity simultaneously. How you do that? When you give extra insulin, when you try to deal with the resistance, but then you are not carbing your sugars, you are not decreasing your eating habits, or the glucose from outside, or you're not exercising, you're not putting in extra efforts, the extra insulin or the extra oral hypoglycemics, they have very less effect. So to curb the diabetes amongst the obese patients, the short way is cut down your weight. When you have less cells, less sugars to burn, obviously you already have that amount of insulin to work. And as I said before also, that when you cut down weight, when you come into the normal weight category, the diabetes may reverse from 150 insulin units to 0 insulin units. You may have your oral hypoglycemics gone out of your life. So diabetes and obesity, they run hand in hand. Most of the people who have diabetes, they are either obese or super obese, and most of the people who are obese, they land up with obesity over a period of time, sooner or later. So deal with obesity first, and diabetes may go hand in hand.
Book your surgery appointment on pristinecare.com. Pristine Care.